Okay. Hi everyone, my name is Rachel and I'm a compounding pharmacist. This will be a little bit different than a lot of pharmacy or pharmacists you hear speak because I'm not going to talk about a lot of the medications. Dr. Chopra did an amazing job of that. I'm going to tell you a little story. Well, I've been a pharmacist for 15 years and for most of that time I've been a compounding pharmacist. I was initially drawn to compounding when I was in school. We learned how the drugs work, but not how they're made. Do you remember that show on the Science Channel called How It's Made? I love that show. We watched it so much at my house that my kids actually had to dance to the theme song. I like seeing nothing turned into something, whether it be a flower vase or manufacturing a school bus. I'm not artistic, so I create with medications instead. Compounding is the method of preparing customized medications to meet unique practitioner and patient needs. Many years ago, a provider asked me, "Who's your target patient?" I was quiet, I thought about it for a minute, and he thought I was confused, so he went on to clarify the question for me. He said, "Do you guys focus on hormone replacement therapy, pediatrics, vet meds, things like that?" Then it hit me. It was an aha moment for me. Our target patient is the one that's left behind, the one that's heard, "I can't do anything else for you." My patient is the square peg trying to fit in the round hole. What I do is, or people like me do, is we don't just come up with the solution. We create it and we make it for you as well. We provide, compounding pharmacies focus on providing innovative patient care. We customize all other aspects of our lives, so why not customize our medications as well? We all have different beverages in here. Some people put milk in their coffee. Some people don't because they're sensitive to milk. We customize everything, so we should customize our medications as well. This could mean making a liquid for a little kid because they don't like swallowing pills. It could be making bioidentical hormone replacement therapy because you're going through menopause or andropause. Or it could be formulating a pain spray or a pain troche. I actually made a fentanyl nasal spray myself yesterday to help someone with cancer pain. It's, making different dosages like that are the customized medications we can make for you. I'm sure that you want to live your life to the fullest and go about your daily routine without worrying, is my opioid medication going to impair my ability to drive today? Am I going to be able to function at my kid's sporting event this afternoon? Or am I tapped out on gabapentin because of the side effects and I can't function? These are all things that compounded medications can help you with. Just last night at the meet and greet, I was talking to a couple different patients, and we talked about different ways to treat the allodynia with some different creams. We also talked about the role oxytocin can play in your therapy in conjunction with your ketamine. There's a lot of different options out there, and a compounding pharmacist can help you with that. These are just ideas that came about, from short conversations. My finger got a little excited there, sorry. What can compounding do for you? We create medications for you to help you. That's all we do. We want you to feel better. It all starts with, how do I feel better? That's all. That's the only question that we need to ask you. How can we improve your outcomes? We can solve these issues using a variety of modalities. Do you need a unique dosage form to adjust or to increase the absorption of your medication? Do you need a medication in liquid form so that you can dose it easier? Can we minimize some of the side effects that come with medications by using it in a different manner? On a side note, did you know that chronic pain patients have low testosterone levels? Compounded bioidentical hormone replacement therapy can help with that. And that's in men and women. Who wouldn't want a little extra energy? That is one of the benefits of testosterone. And we make that for you, low dose or high dose, depending on what your need is. Do you need a variation of medication that's not commercially available? Do you have autoimmune issues that make you more sensitive to certain dyes and fillers, like what Dr. Chopra was saying earlier? We can make those medications that meet your needs. In theory, if the medication is in the correct dose and you're receiving it in a manner that allows your body to best utilize it, you should have better outcomes. Your body's not going to be fighting the medication. Like I mentioned earlier, it all starts with a question. How can we make you feel better? We know what the problem is now. How can we address it? We reach into our toolbox, our nice 1920s toolbox, to look for the solution. We use all kinds of different chemicals in a wide variety of ways. Our commonly used routes of administration are oral meds, nasal sprays and irrigations, sublingual dosage forms, and topicals. We can combine multiple medications into one dosage form so you don't have to take a handful of pills at one time. We can make capsules immediate or delayed release. Do you have stomach issues and you need to have that medication not hit your stomach all at once, but slowly over time? We can do that. Nasal sprays are a great delivery system. There is rapid uptake of the medication into the system, and it limits the amount of systemic absorption of the medication, so you're not going to get the side effects that you would get if you took it orally or IV. The sublingual route through the oral mucosa is very similar to the nasal administration route. The uptake is quicker, and it avoids first-pass metabolism, which is where we get a lot of the side effects that people experience with medications. We can use topical creams to apply medications to the site of the pain. Dr. Chopra mentioned ketamine for the lesions. Literature states that when you apply a medication topically, for a pain medication, you're going to get about 1% to 3% absorption of that medication. So we can use medicines that you wouldn't normally use orally to help affect to help without the side effect profile that you would see taking it orally. For example, amitriptyline causes a lot of side effects, but it works great for neuropathic pain, but we don't use it very often because a lot of people don't tolerate it well. When you apply it topically, you don't have those issues. There are a lot of unconventional ways that chemicals can be used. That's how low-dose naltrexone was discovered. It was used for a different indication, but they found at low doses it does help with pain issues. There's other medications in the marketplace today that were discovered for the same way. Think of the little blue pill. It was not designed for that, but they found that as a side effect, and now that's how it's used. Thinking outside the box like this helps drive new therapies for patients and helps them come with better outcomes. Creative solutions take time. These are actually some of the books that are at my workstation. It takes lots of research. You never know where an inspiration is going to come from. We have lots of resources and forums like these to search for ideas and solutions, but they're not the only places to get information. A few weeks ago, I was watching on YouTube, I hope I can say YouTube, a presentation by Dr. Chopra called Diagnosis and Management of CRPS and Comorbid Conditions. He was talking about the role of the glial cells in CRPS. He went on to discuss low-dose naltrexone and ketotifen, or ketotifen, depending on how you pronounce it. This is not new information for me. We dispense this all the time at my pharmacy here in town. But something about the way he described it made me think about the medication differently. The issue at hand is getting these medications across the blood-brain barrier so that they can affect the glial cells. Currently, ketotifen and low-dose naltrexone are given as oral medications, which means they have to go through your whole system and go wherever they want in your body before they can get to the blood-brain barrier, or across to the blood-brain barrier. Would it work better to get it to the target area faster if we used it as a nasal spray? We use nasal sprays to get medication across the blood-brain barrier quickly to abort seizures. Can we use the same pathway to deliver medications into the brain as quick as possible for the glial cells? I called Dr. Chopra, whom I had never spoken with before, and we discussed the idea. We lobbed ideas back and forth. Can we use another ingredient to open the cribriform plate? Can we use a sinus rinse bottle to deliver these medications? Will this work? We agreed to do some digging and discuss it this weekend. We talked about it a little bit this morning. He then asked me about ketamine and ways to neutralize the pH so that it was not as irritating to the mucosa. These are just a few examples of how an idea becomes a medication. I was at the meet and greet last night and spoke with some of you, and on the way home, after some of the feedback I heard from people, I was trying to think of a cost-effective way that would allow a person with an active lifestyle to still use ketamine. They were having some issues getting it from a local pharmacy in their area, and they were getting gouged, in my opinion, on the price. This piggybacked on the conversation I had with Dr. Chopra a couple weeks ago. Can we use ketamine in a nasal irrigation? I had some questions. Do CRPS patients use nasal irrigations, sinus rinse bottles on a regular basis? I didn't know the answer. Would that be too irritating or trigger other symptoms you might have? Will the additive to the ketamine capsule help, or will it hinder some of the symptoms that you're experiencing? Will it make the ketamine less irritating? Once the ball starts rolling, you never know where it's going to stop. Just kind of snowballs going downhill. This morning, Dr. Chopra and I discussed ketamine again. In just a few minutes, we had multiple ideas that I'm super excited to pursue. In his speech, Dr. Chopra talked about the irritation of the mucosa that is caused, and that's why he alternates between sublingual and nasal. Listening to him talk got me thinking of some other ingredients that we could maybe try for the sublingual variations as well. I don't know if they'll work, but it's worth trying. Just because it hasn't been done before doesn't mean it's not worth pursuing. There's always a new idea out there, and it's always worth trying. And if it doesn't work, it doesn't work, but if it works, that can be a game changer for people. How do you pick a good pharmacy? A good compounding pharmacy? There's a couple questions that you can ask to get the answer. What accreditations does your pharmacy have? Do you see this emblem here? This is our industry standard for excellence. This is a voluntary program that only a small amount of compounding pharmacies in the country have gone through. It's a very lengthy, very exhausting process. But it stands for quality. It says that we're going to take care of you. We've got policies and procedures in place to make sure that you're getting the best ingredient made by the best people in the best possible manner. They come, they inspect every couple years. It's a rough couple days when they come in because they go through all your files to make sure that you're doing what you say you're doing. It's not easy to get this accreditation. My pharmacy here in town, Clear Spring Pharmacy, has had it since 2013, and we are very proud of it because it's not an easy process to go through. Can your pharmacy bill insurance? Even if you're paying out of pocket for your medication, it's still an important question to ask. Most insurance companies will not cover compounds at all unless the pharmacy has gone through an accreditation like this or an NAB, National Association of Boards of Pharmacy certification. They want to make sure that your pharmacy is meeting every single standard possible. So even if you're not using your insurance, ask if the pharmacy is willing to try, because that tells you a lot about the quality and the processes and procedures that they have in place. My NABP certification was so tough. It was 3 days, and I felt like I was in a movie where the FBI is just grilling you. But it worked out. We got our NABP certification, and now we can bill insurance across the board. So it's a really important question to ask. What certifications do the pharmacists, staff, or technicians hold? For example, I'm a certified hormone replacement specialist. It means I've done extensive online training as well as attended seminars and proven my proficiency in hormone replacement therapy. Did the compounders learn on site, or did they go to professional training someplace? It does make a difference in who teaches the compounders how to make the medications. Do you know where the chemicals come from? Not all chemicals or medications, we call them chemicals, are created equal. So it's important to know where they came from. And ask your pharmacy, do they know where they came from? Do they know the quality assurance process that the wholesaler puts the chemicals through prior to them getting to the pharmacy? I do. My chemical supplier has a 14-point checklist that every chemical goes through. They reject 10% of their chemicals per year for not being good enough. It's an important question to ask. Will the pharmacy tell you all the ingredients in the compound you're getting? Believe it or not everybody will tell you all the ingredients that they're putting in your medication. Why? Why won't you deserve to know what's in your medication? Lastly, interview your pharmacist. This is a relationship that you're going to build with the person. You need to know them. Do they take the time to meet you, to talk to you, or do they blow you off? Ask them a few questions about things that are important to you. See if they're knowledgeable, or see if they're willing to learn. First CRPS patient that came to me, I'll be honest, I didn't know very much beyond what I'd learned in college. But I was willing to learn, and that's important. You need to interview the pharmacist as well. To understand the problem, you have to listen to the problem. That's the most important part of the whole process, is the relationship that you're building. Can you talk to your practitioner and feel like they're actually hearing what you're saying? They're not thinking of the 15 emails they just got in the last 10 minutes or a text message they have to respond to. Are they actually listening to what you're saying? Chris has given me permission to talk about our experiences together to manage his CRPS. This picture was taken in 2017 at a local ER after he had been turned away as a drug seeker when he was in intractable pain. Does that sound familiar to anybody? I'm not sure the exact date that Chris and his dad Richard entered into my life or what medication we initially spoke about, but I can tell you that it has been one of the most professionally rewarding and challenging relationships of my career. It may sound strange to hear a pharmacist talk about the relationship with a patient, but that's how it should be, and that's how it was for many years in my profession. The local pharmacist and soda shop operator dispensed as much wisdom as they did medication. Whenever you see an old movie, you don't see the pharmacist behind the counter mixing medications. You see him at the counter listening and making a great phosphate soda. And they listened. They just listened to what was going on. I feel medicine as a whole has gotten away from listening. Chris and Richard made me listen to them, and I'm so glad that I did. I've learned more than they have over the years, by far. The process takes patience. Not every solution is going to be a home run. There's a lot of modifying that goes on with compounding medications. The nice thing is that we have that option. Modification can occur. That's not always the case with traditional medications. Some medications only come in 3 or 4 strengths. I can make them any strength you want, any form you want. We'll try it. We learned over the years that we can't rest on our laurels. Just because something worked once didn't mean it was always going to work. We always had to keep innovating, and we always had to keep learning. In addition to topical formulations of ketamine, amitriptyline, hydromorphone, and gabapentin, sometimes separately and sometimes in combination, we tried ketamine as a nasal spray with and without xylitol. Xylitol helps break down the biofilms in the nasal cavity. The idea is that if the medication can penetrate past the normal nasal defenses, it can get into your system better and work better. That means less sprays, less irritation with the medication. Chris's sinuses were much happier after we started adding xylitol because he didn't have to use as much. As many of you know, ketamine troches are extremely useful for the treatment of CRPS. More and more research is being done on ketamine, and the results are promising. We tried ketamine troches, or ketamine sublinguals as troches, both full size and mini. We made them for polyethylene glycol base and gelatin base. We made sublingual tablets from rapid dissolving base. Most troches are made from polyethylene glycol, and for some people, especially ones with autoimmune issues, it can cause GI problems. Leaky gut and polyethylene glycol do not go well together. So we switched them to gelatin. It's better tolerated by people with autoimmune issues. The gelatin is synthetic, just so you know, we get that question a lot. It does not come from horses, it is synthetic. It offers an alternative route of administration with a similar mechanism of action. Rapid dissolve tablets dissolve really quick. They're a minute and a half. They taste great because mannitol is the main ingredient. And it gives us a new alternative to delivering medications. Richard and Chris were looking for an alternative to going to the ER to get IV hydromorphone. Chris didn't like oral hydromorphone, and it didn't work that well for him anyway. We formulated hydromorphone as a rapid dissolve tablet. It worked okay, but it wasn't great for the breakthrough pain. I played around on the website of one of our chemical manufacturers that has a ton of resources. I discovered a formula for hydromorphone nasal spray. I told Richard about it, and he passed the information along to Chris. At Chris's next doctor's appointment, he walked away with a prescription for hydromorphone nasal spray. We played around with the dose and ingredients over time. We removed the parabens from the formula, because a lot of nasal sprays are made with parabens, so that you can use it for a little bit longer, because the parabens is a preservative. Without them, the compound does break down faster, but it doesn't irritate the sinuses as much. We added xylitol to this one as well, so that it wouldn't irritate the mucosa, and he wouldn't have to use as many sprays. Chris went 6 months without a visit to the ER because he started using this medication. Chris and his family moved from Denver to Florida in late 2018. The buildup to the move was intense, and there was a lot of strategizing that went along, or amongst his healthcare team. We thought we had every I dotted and every T crossed. Boy, were we naive. Colorado, especially in the winter, is very dry. Very dry has never been used as a descriptive term for southern Florida. Shortly after he arrived in Florida, Chris noticed he was having some issues with his nasal sprays. The spray bottles were getting clogged a lot faster than normal, and it was most likely due to the humidity. He tried to get the spray made locally, but he was still having the same effect. We decided to make smaller batches that he could fill more often, so as soon as it started to clog, he wasn't throwing as much away. That worked for a little while, but we knew we needed a longer-term solution. Nasal sprays are technically considered a topical application under current USP guidelines. USP are the compounding rules that we follow. Hydromorphone worked really well for him nasally, so maybe it would work well if we tried it in a different topical application form. Many years ago, we discovered that when we make hydrocodone as a topical cream for tonsillectomy in kids, they could apply it to the wrist every 4 to 6 hours to get pain relief. This way, the patient didn't have to swallow that nasty alcohol-filled pain medication that was going to give them a stomach ache, or stomach upset, trying to combine that together. And it could cause vomiting, which if you've just had your tonsils out, you don't want to vomit. That's not a good option for the kiddos or adults. So we tried hydromorphone gel, and it worked, or hydrocodone gel, and it worked great. So why can't we do that with hydromorphone? When I was talking to Richard one day, it hit me. Let's try it with the hydromorphone. We wouldn't have the short beyond use date issues or the clogging issues that he was having with the nasal sprays. We talked about the idea for a bit, and I told him I wanted to do some research, mainly to figure out what kind of dose to give him. This was new territory, and we needed to make sure that we were giving Chris something that was going to work and not do harm. After a literature search, we decided on 1 milligram per 0.1 ml to be applied to the wrist. Applying it to the wrist is important. It's very thin skin, and the blood vessels are right there at the top. The medication gets into the bloodstream very quickly. If you apply it to an area that has a little bit more meat on it, like my forearm, it's going to take time. If you're having breakthrough pain, you want immediate relief. So that's why it's important to apply it to a thin skin area like the wrist. We were all nervous. Chris does not like change at all. And this is a huge change. Richard was nervous because we didn't know if it would work. I was nervous because I was afraid it would work too well. My staff made the topical cream, and we waited. I didn't hear anything for a few weeks, so I thought it didn't work, and they were just being polite and not telling me that it failed. A couple weeks later, I got this email. It said, Chris woke up at 4 a.m. with lumbar sacral pain, took several hits of the nasal spray, no effect. Around 10 a.m., he applied the first dose of the cream. The good news is that it worked. Then we decided we needed to adjust the dose because he was a little groggy afterwards. About 2 hours after I got that email, I talked to Richard and Chris. They were over the moon. Chris was on the verge of his first trip to the ER in 9 months. Then he applied the cream, and that afternoon, he was outside walking his dog Leo and watering his plants. He even made tacos the next night, which is something he had not done in a long time. It was amazing, the outcome. Our multimodal approach to Chris's ketamine therapy had worked well for him so far. It was a game changer, actually. He really likes this picture, by the way. But like any medication, ketamine has side effects. One rare side effect of ketamine is called ketamine cystitis, very intense bladder irritation. Due to this complication, combined with his elevated liver enzymes, we needed to find an alternative to the ketamine for him. Levorphanol works on the same receptors in the body and has a longer half-life, which means he wouldn't have to take it as many times a day. But how do we dose it? Commercially, it's available in 2 and 3 milligram tablets, but we needed to start at a much smaller dose. The tablets are super small, which means they're really hard to cut, and they're also super expensive. They're like $50 or $60 a tablet. Cutting the tablets in half or even fourths would give you a good average dose over time, but we needed something that we could control better for each dose as we titrated it up. We decided to put it in a suspension. This allows for the ease and accuracy of dosing that we were looking for. He would go up slowly on the medication, and we didn't have to make a bunch of different strengths of the capsules. He was able to start at 0.25 milligrams per dose and work his way up gradually on his timetable to the 2 milligrams. He had control over how he adjusted the med, which was huge, and that's control he would not have had with traditional medications. Florida is home to many great theme parks, and there are a bunch of roller coasters to choose from. We do not recommend the roller coaster that Chris went on this summer. He had great days and horrible weeks. We felt all of his ups and downs at my pharmacy. We made different strengths of ketamine troches, changed the strengths of the nasal sprays, and brainstormed many ideas for him. Some of them that came to fruition, some of the ideas we immediately threw in the trash. His spirit and an extremely supportive collection of medical professionals kept us going through his darkest days. We tried many different formulations of ketamine. We tried levorphanol, like I just mentioned, and we tried hydromorphone, in addition to ketamine infusions. It was rough. There were multiple hospitalizations over the summer, and at times it did look bleak. But luckily, we all worked together. The doctors, the nurses, his support staff, his dad, his brother, his family. It turned around. On one Saturday afternoon a few weeks ago, Richard let some of Chris's healthcare team know that for the first time in months or longer, Chris was experiencing 0 out of 10 pain. I reached out to Chris with my excitement, and here's what he said to me in return, and I'll try to keep my composure. I said, dude, I'm excited for you. And he said, yeah, I can hardly believe it myself. I knew I would benefit from the infusions, but I'm still blown away. I haven't felt like this since the last loading dose I had with Dr. Hannah in 2016, when I started this whole ketamine journey. For me, it's the best treatment option I've found. It prolongs my life and allows for a better quality of life. I couldn't be more grateful for your help and support on my journey. None of this could have happened without you or your involvement. You are one of my heroes, my friend. Thank you for all that you do for me and people like me. I was touched beyond words. And then yesterday, I heard from Chris again. I mean, I hear from him every day, but I heard from him again. He said, "Hey, Rachel, thought you'd like to hear I've experienced a 0 out of 10 pain level on Thursday and Friday. Hope you're doing well." It's those moments that get me, and it gets my team as well. This is my team. I shared Chris's kind words with my coworkers. Everyone was touched and more motivated than ever to come up with innovative new ways to help patients improve their health. It's great to work with people that are willing to think outside of the box and to come up with new solutions. We don't see "it hasn't been done before" as the end of the road. There's always something else that we can try for you. What's next on this journey? Low-dose naltrexone, oxytocin, ketotifen, all are options worth discussing. What new formulations will we come up with in the future? Who knows? But it's exciting to try. This is only one example of the relationships that we have with patients. I look around the room and I see a couple more that we have built relationships with as well. And I'm eager to develop those over time into more meaningful relationships. We don't just help CRPS patients, we help everyone. We help babies that have seizures to elderly people that have arthritis and everyone in between. The issues we see are varied, but the approach we take is always the same. How can we make you feel better? It all starts with listening, then adjusting, lots of adjusting. Please ask your compounding pharmacy how they can help you. I bet they have an idea. This is the contact information for Chris and myself. Chris is happy to answer any questions you might have about his experiences with CRPS and many of the different treatments that he's had over time. And then there's my contact information as well. And I'm happy to answer any questions you might have.